You know, in Denmark, we have universal free and equal access to healthcare. We have been used to being registered in the Danish society for more than 40 years. We created, and that's where we have been cheating a little, a unique identifier in 65 or something like that. We created with the purpose of collecting taxes, which is always good. So that has been our main driver for the registration process in Denmark. So we have had national databases where you have the possibility to follow every citizen from cradle to grave. So we are used to being part of a registration theme. So we are used to people or the public collecting data about us. There's a widely trust in the Danish society that we actually do that as public institutions with the purpose of creating the good for the citizens. And we have as Danish citizens, and I think that's also quite important when you're talking about the digitalization, experience that it actually delivers you an easier daily life, so that you get access to your public services in a far better way than you used to do. And we have created a number of quite efficient services. I think when you are creating a company, Denmark is the country in Europe where you can do it fastest, because you do it all online. You're up and running within an hour. And that's due to the digitalization of the public sector. We have the 5 regions in Denmark that is the main responsible for the healthcare service that are providing the services and also paying for the primary care sector. And then we have the portal, the citizens' access, and this is all about the citizens' access to their own data, and that's where we started in 2003 in Denmark. And we have the portal that is the unique access point for all healthcare data in Denmark. And we created with the vision that we wanted to create a user-centered healthcare universe that is coherent and create values for the citizens and for the health professional, and with the focus on empowering the patients in the meeting with the healthcare services. So this is our vision. So it's really focused around the service provision towards the citizens. Basically, we have 2 products. We are a very simple company. You can either go on the web and have access to our web portal, or you can use our app, which is a slim version of the portal with the most relevant information that we have. You can go in as a citizen and have access to, in principle, 95% of all the data that we have in the Danish healthcare sector about you individually. So you can see your referrals, your appointments, your discharge letters, your lab results, your medication, all the prescribed medication. You can communicate with your GP or with your private specialist. You can see all the data that we have about you in the national registries. And you can see your vaccinations efforts and so on. So basically everything is there online when you want it, and you can just go in and get it. So let me just. Besides the personal data, you also have access to validated healthcare information. So what is the right treatment? What are the diagnoses that is, or how is the description of the diagnosis and the procedures and so on? Everything is validated by, I think we have around 500 different editors sitting around Denmark and is editing the medical information that is in the portal. Because it's really important that when you have access to medication or to medical information that is actually validated and authorized by the public sector, because this is the place to go if you want to see what is the right treatment procedure, what is the pathway, and so on. So we spend a lot of effort on that also. When it comes to developing the services, we have spent a lot of effort in actually having a user panel. So we have more than 3,000 people around in Denmark that have signed up to be part of the developing process. So every time we develop a new service, a new functionality, whatever, we have a huge panel of citizens or healthcare professionals that we can reach out to, that we can pull into the process and actually develop the service so it fits the purpose and fits what the citizens are expecting of us. And I think that has also been key to the success of the portal, is that we actually have spent so much time and effort in involving the citizens and the healthcare professionals in the development of the services. But we are not only the access point for the citizens' access to data, it's also healthcare professionals. If they want to have access to data outside of their own medical record, if they get a patient from another region, someone they haven't seen before, they can access the portal and have access to exactly the same data as the citizens. And really importantly is they do it directly from their own electronic medical record system. So there is a direct integration and link between the individual medical record systems and the portal, where you go directly into the same patient's data if you click on that. 95 or 99% of all healthcare services or healthcare engagement is done in the local medical record system. That's where you are working as a healthcare professionals. Sometimes you need a little information outside, and then you need to have easy access. But 99% of all work is done in the basic medical information system. I think it's really important to remember that when we're talking about big European projects, because that is maybe 0.1% of all healthcare that is taken care of in a European context. 99% of everything is done in the local medical record systems. But sometimes you need to get access to something outside. And then it has to be smooth, easy, and accessible, and of course secure. Now, the way we build it in Denmark, and that is maybe because we started in 2003, because at that point in time that was the only way to do it, is that we don't have any data at all in the portal. We only retrieve data on request from the citizens into the many different systems that we have in the Danish healthcare system. So all the electronic medical record systems, all the lab systems, all the medication systems, whatever we have, there is an integration between the portal, where the citizens or the healthcare professional goes in, and the underlying systems. So we have around 170 different integrations at the moment. They are, of course, all based on some kind of standardization. We also started the standardization in the 90s, so we are still using the good old EDIFACT for some of the integrations, but we are moving slowly but securely into HL7 FHIR. This is extremely expensive and extremely painful to do. I've been through the process of changing a national standard once. I still have the scars, probably still bleeding from some of the experience. It is so painful and so costly to do this. And that's, you also need to take into consideration when we are talking about European standards and blah, 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 because who for it? And is there another way around it? We built it, the portal, step by step. We didn't build it all in once. We built it adding services on service on service over the last 20 years, so that we now have a quite comprehensive portal where you have access to nearly everything in the Danish healthcare system. Because we added on time by time, as we got consensus in the Danish healthcare system about what was needed, what was relevant, and how should we do it. We are the most used service in the Danish healthcare system for healthcare professionals outside of their own medical record system. It's used around, I think, 350,000 times every month by healthcare professionals. We got quite famous during Corona. It helped us a lot to be known by the citizens, because we were the place to go to get your Corona passport, your vaccination, and all these kind of things. So that was a lot of fun. So we are well known today, and we are used. But we also make an effort in actually knowing if we are relevant for the citizens and for the healthcare professionals. So we do surveys twice a year around citizens and healthcare professionals to ensure that we actually deliver something that they find useful. And they do, most of the time. Sometimes we can identify services that's either not used or should be better, and so on. But we also, by that, know that, surprise, surprise, the main user of the portal is middle-aged, well-educated women, because they have the responsibility to take care of their children, the family, the parents, and probably also the husband's healthcare. So they are the main users. They were before Corona. During Corona, it was kind of messy because everybody was using it, but we are now back to normal. It's back to the women that has to take care of everything in the family. So they are also our primary customers. Of course, we can see after Corona that elderly people are using it more than they used to before. We had the surprisingly experience during Corona that a relatively huge part of the young people didn't understand what they were doing, or what we were doing, or how to use the portal. Not because they couldn't use the technology, but they didn't understand the system they went into. What are the healthcare system? How is it set up? What are the structures? How am I going to act into that? So there's a different kind of health literacy among young people than there is among elderly people. And our user support has a surprisingly huge number of young people calling in during Corona because they didn't understand what services they were getting. Interesting thought. So that was a short introduction to what happens when you start a little too early, maybe. But that's where we are today. And I think, at least from my point, there is many different ways to giving citizens access to their data. And you should, or we should, as in a European context, take a discussion around how can we build on what we have and how can we use that most efficiently.